All right, so welcome, welcome, welcome. We are getting ready to start. We'll have another panelist who will be joining us momentarily. Dr. Dion Middlebrooks, who is just an absolutely phenomenal individual. She will be joining on here in just a bit as well. And so my name is Dr. Joanne Michelle Martin. I was blessed, myself and Dr. Middlebrooks were blessed with the privilege of being asked to come on as instructors for AMREF International and the Johnson Foundation program, Jackson Foundation, sorry, program for educating other physios in the niche of pelvic health. And we were extremely excited to come on board. We were extremely excited to come into Kenya. And little did we know that it was going to be just so fantastic. It was more than we could have ever imagined. I apologize. I'm recovering from the flu. But little did we know it was going to be just such a wonderful experience. And one of the things that, that we wanted to do was to just continue to contribute, continue to give back, and help in any way, shape, or form that we can to magnify the efforts of the amazing physios there at AMREF and in Nairobi and throughout Kenya as a whole on all the wonderful programs that they're doing. So today I've got with me Henry Banda, who is the overseer of this phenomenal program. And we want to give him an opportunity to just share with you all the amazing things that are happening, about, things going on in the program. I also want to put in a plug that here in the United States, this is Black History Month, and what better way to start Black History Month than just elevating our community. We may be in different countries, but we are all the same. I was born and raised in Barbados, living in the United States now. And so just an amazing opportunity to continue to elevate the efforts of others, and to highlight what we're all doing in our particular areas. There's that saying, you can go, if you want to go fast, go alone, but if you want to go far, go together. So without further ado, I will let Henry introduce himself and then we'll get started. So Henry, tell us a little bit about you and a little bit more about AMREF, just as a whole.
Thank you so much, Dr. Joanne, for this opportunity. I'm Banda Henry Opondo. I'm a physiotherapist by background. Currently, I'm more into administrations, and currently I do coordinate the physiotherapy specialization programs under the Jackson Foundation in AMREF International University. And I'm glad that we met a couple of months ago when you are helping us with the Pelvic Health Physiotherapy Specialization Program. So at the AMREF International University, it's a premier university basically focusing on healthcare sciences for healthcare workers. And with respect to physiotherapy, which is domiciled under the School of Medical Sciences, we have currently we have 7 programs within physiotherapy department. We have the fresh entry bachelor's degree, we have the upgrade bachelor's degree, and then we have 5 specialization physiotherapy programs at advanced diploma. One of them being pelvic health physiotherapy, we have cardiopulmonary physiotherapy, we have pediatrics physiotherapy, we have neuro rehabilitation, and lastly, we have cardiopulmonary and pediatrics as well. With that said, specifically now to the specialization programs, they are developed in a way that they are meant to upscale and upscale the competency level of various physiotherapists that chooses which domain they really want to specialize in. So largely they're designed to improve clinical mastery of the clinicians so that you can be able to optimize your patient outcomes. and they're basically targeting people who are in practice. You must have graduated as a physical therapist to be able to take these programs. And these programs are designed in a way that you're able to do the program while still working if you have a work to do. So it doesn't require you to be physically present at the campus or at the university for the whole 2-year duration of the program. Thank you.
That is awesome. And hybrid programs, especially since the advent of COVID, have been phenomenal in educational spaces. What are the biggest challenges that you are finding in terms of maybe running a program, especially an advanced practice program, within your area and within or just in terms of reaching out to others who may be just immediately outside of your area, outside of Nairobi, so maybe even in the more rural areas?
I think the biggest challenge currently for physiotherapists to go back and get this clinical mastery is resources to raise the tuition fee. If you look at the current economic status versus the tuition fee, many people really struggle to apportion this to go for upscaling their competency level. That is the biggest barrier that I think I've witnessed both within the settings, the urban setting and the rural setting.
Okay. And then in terms of the university itself, are there any needs of the university in terms of items for practicals for students? Do you find that as you are starting to elevate the status of the university programs and offerings, that there are maybe even challenges there?
Yes, absolutely. So you find that, as I mentioned in the introduction, that these programs are largely to improve hands-on activity or hands-off in physiotherapy practice. And they are accompanied by various tools that are useful in probably evaluations and also even in treatment. And some of these tools are really backed up with certain evidences and they're in the books. So you find when we have got probably the labs, the physical labs, and even now the implementation of what has been learned, you find that there's a lot of scarcity when it comes to the materials and the supplies that are necessary to aid the service delivery based on the key competency and on various specializations. So this is a big challenge, and actually it's also somehow make even the implementation of what is learned in class becomes a little bit hard. And when it's not implemented on time, there's high chances that with time you'll tend to lose the skills. So that's another big challenge.
Mm-hmm. Is this more so you find just at the university level, or is this something that you find also more at the national level in terms of getting things into the country and helping leaders to understand the need and even the urgency as it relates to some of these things?
I will say yes, it's widespread. It cuts across from the training institutions to even the healthcare facility. But on the other side also, the question is, the healthcare facility will be able to procure certain items if they have competent staff that are able to utilize them. So you find probably number one, the entry level is that do we have staff who understand what need to be used and are they able to pronounce various materials that are needed to meet the patient needs. So it starts from there. The hospital may not, or the healthcare facility may not be able to purchase probably an equipment that is related to advanced training of the pelvic health muscles if there's no one talking about it as a physiotherapist within the leadership or within the institution. So it starts actually largely from the entry level, then it now goes to the healthcare facility. So I will say, yes, it is widespread, but probably it's because also how we were trained, probably we're trained with the old method, the old materials that were published sometimes back, but with the changes in evidence-based practice, whatever is coming in, it takes us time to implement. So yes, at the university level and the healthcare facility, there's that scarcity of the various equipment to support service delivery related to physiotherapy programs.
Mhm. So let's switch gears a little bit and talk about pelvic health, because most people don't even know what that is, right? And so, this is, most people think of physios as orthopedically trained, orthopedically minded professionals. And then there's a specialty of pelvic health. Why did you feel like this was something that needed to be brought to the institution?
I think number one, the perception from the beginning of physiotherapy, probably the history tells us that physiotherapy started with the World War, massage, and so forth. So that perception probably has stuck in many of our colleagues or the public setting, that physiotherapy is largely musculoskeletal related issues. So if there is a place for physiotherapists to manage pelvic related cases, I think number one, it need to be really vocalized, because it is one area that I think is still very sensitive in our community to talk about. The issues of pelvic are really, really things that you keep to yourself. There's a joke here that men will only go to the hospital when they have pelvic related issues. When they don't have any pelvic related, whether it is headache, hypertension, they'll manage it themselves. But when the one things start falling down, then they'll really seek uh, uh, medical attention. So truly speaking, there's a lot of suffering in silence that probably is going on among the many populations without really knowing the role of a physiotherapist, and probably that leads to high consumption or probably some uh, over the counter medications that probably could be reduced with physical therapy interventions. On the other side also, we only tend to hear of pelvic related cases, assessment, evaluation, probably when there is a when a bad act has taken place, probably among a teenager or a woman, and now there's evidence that are needed in the court. But who is following up on this person post the court evidence? Are they suffering in silence? The answer is largely yes. So I think this is something that really need to come out loudly, that we have physiotherapists that are able to diagnose and treat pelvic related conditions. And it shouldn't be just seen that pelvic related conditions are probably just issues to do with maybe erectile dysfunctions or leakage. It could be very wide conditions that probably our sisters, our parents could be having.
Mhm. I agree. I always say pelvic therapists have the most fun. And I think that a lot of people assume, especially a lot of traditional musculoskeletal physios assume that there is a need for internal work. We hear pelvic, we think internal, but there's so much more happening. And you are correct, men, women, children, the elderly, we have to think about hormonal impacts. So not only as we go through the period of fertility, periods through menopause, but even post-menopause, and dealing with hormonal changes for both male and females, for throughout their entire life. When we came, we worked with we did a lot of obstetric pelvic health work. And we did a lot of education surrounding that population, pregnancy and postpartum. What do you think? What do you think that can do for most physios, including not just the ones who want to be centered in pelvic health, but including our orthopedic colleagues to help elevate their level of care?
Say it again.
What do you think that that knowledge base of even having that obstetric pelvic health component that AMREF is offering, what do you think that that can do for for our orthopedic colleagues to help elevate their level of care?
Yeah, I think sometimes there's this fear that the more you get specialized, the more you tend to work in isolation. But I think among even the orthopedic manual physical therapists around, there are probably some cases that present probably like back pain, but they probably could be coming from the pelvis, and a number of treatments over and over and over. You get a little bit frustrated. You start to wonder what could be going. I think it would give us an opportunity whereby a pelvic physiotherapist and an orthopedic manual physiotherapist can actually have a discussion together for the sake of the patient. And this is bringing just interdisciplinary collaboration, working together as a team, looking at the patient holistically than just looking at the patient as a medical condition on the back. So I think it's an opportunity that we are able to work together. It also gives us an opportunity to begin research, evidence-based treatment that work very well for our patients. So I try to imagine a physical therapist from orthopedic background and a pelvic background come together and start to discuss the outcomes, the treatment they give, what works, what doesn't work, for which populations, and so forth. We'll be able also to be able to generate certain data that can inform our decision making and improve our outcomes as a country.
Mm-hmm. I like that. I oftentimes, when I teach, tell my orthopedic students, you know, as long as you are a therapist, you can be a pelvic therapist. It doesn't mean that you have to do any internal work. But again, if we think, for example, of that pregnant and postpartum population, we think about whatever the population of females in Kenya is, which if it's kind of comparable to the world, it's probably half of the population is female. Then you're looking at, you have the potential for at least half of your population to be reproductive at any point in time. And now that's a whole population of people that might need those services as well. And so there's so much that can be done for individuals during these times. Whether it's the educational component, the hands-on component, or like you mentioned, just navigating care, the interdisciplinary components of care to help make care that much better and to help elevate the standard of care that's already being given. So I absolutely agree with that. In terms of the different areas, so Nairobi is a relatively big city, and you know, I enjoyed my time there. There were lots of hospitals, lots of good access. What about the areas outside of Nairobi, and how are we helping to get care there, to deliver care to those areas, to ensure that persons in those areas get the care that they need?
Still, we have a big gap, very, very big gap that we're trying to solve as a nation, because we tend to find physiotherapy services largely available in a higher level of care, level 6, level 5, more in the urban setups than in the rural setups. So this is one component where we talk about the primary health care, trying to promote services up to the last mile, up to the rural level. So probably what I can say, some of the approaches we've been trying to do, and which I think is picking up, we find also physiotherapists coming up from the lower level and showing up, signing up for these trainings. Some are short trainings, some are like the advanced diplomas, and of course with a lot of accessibility challenges. But what we do is also now we link them up with some of their peers to be like their mentors who can be able to provide opportunity for like discussions, case discussions, grand rounds, some things like that. So that is it. But largely, there are less physiotherapists in the rural setup than in the urban center because of the absorption rate. Two, we also find that the awareness, the population in the urban center are more aware of their health needs. Hence, they tend to have informed decisions to seek medical or physiotherapy services than in the rural. So that's also contributes. Thirdly, I also say that you find that in the urban center versus the rural setup, there's also what we call the priority. So you find like you go to part of this country probably called Samburu county, and you compare Samburu and maybe Nairobi, you'll find that their priority will be they need water. They're not thinking about any other thing. They need water and they don't want to hear bullets. Yes, so you find that also that kind of environmental exposure and socio-cultural and economic activities within the community also plays a role. So you can actually get a pelvic physiotherapy or orthopedic physiotherapy, send them to Samburu. They may not even see patients coming to the clinic because also the priority of the needs of the population. So those are some of the different places that we have. But largely, I'll say that with the devolution, where the government decentralized services, we're able to see different counties also showing a bit of interest in physiotherapy uptake, and we are seeing different physiotherapies also stepping forward to improve their clinical efficiency in terms of specializations and the short courses.
Are we seeing more of an uptick in services like pediatric care, geriatric care, and those different types of niche services, or are we still seeing a lot of the largely musculoskeletal sports rehab?
I will say musculoskeletal. Musculoskeletal is still on the higher side, and that cuts across urban and rural. Urban is largely nature of our work, sedentary life, and so forth. Rural, it's more manual labor, hard labor, and so forth. But there are also other other disciplines or other subspecialty that are coming in, like cardiorespiratory, due to the environmental exposure. It could be industrial environmental exposure or the living environment exposure in terms of the waste and so forth. There are others that probably could be sorted, but due to the sensitivity of the medical conditions and an awareness of the medical conditions that can be sorted by physical therapists exist. So we find like pediatrics, there are certain communities that children that do present with certain pediatric conditions like cerebral palsy. These are children that we still think are bewitched. These are children that we want to hide away from the public, so they will not get to have physiotherapy services compared to their band center, whereby the parents are a bit informed and they know these are medical conditions, so they're able to seek physiotherapy services. But again, pediatric physiotherapy services, like in Kenya, has not been so much of high uptake by physiotherapists themselves. For reasons that I cannot really say, but probably I think a few of us has got a feeling that occupational therapists do so well with the children than physiotherapy. It's just a perception. So we trying now to look at what we are feeding the students, what we are feeding our physiotherapists at the training institutions. Does it give them the confidence and the competency to meet a kid, meet a child, and have a conversation with the parent and demonstrate to them their role as a physiotherapist in the management of the child? So probably that can also be a contributor, that we let our colleagues out to manage pediatric conditions, but when they're really not having sufficient skills to demonstrate on how to manage these children, compared to what we do a lot on demonstrate, giving them various methodologies of the treatment approaches on how to manage a sprained knee, a back pain, and so forth. So that can also be a contribution to the different uptake in pediatric physiotherapy. So Kenya largely is known for musculoskeletal related conditions, and I think I'll say largely in East Africa, musculoskeletal comes on top. We're having cardiorespiratory coming. We're having sports injuries also coming on top of the list. Here, geriatrics, we really do not have a lot of uh, value for the elderly like you do in the States. But we have few geriatric homes that take care of these people, and we do have physiotherapists being exposed to those areas and provided with the what do I say? Provided the skills on management of geriatrics. But another thing that also poses a challenge is that when you provide services, that service is supposed to be compensated for. So you find that the geriatric populations, they really have no one to take care of their medical needs. And if there's someone to take care of their medical needs, but they'll want to take care of their medical needs in terms of, are they able to breathe? It's not about how flexible are they. So you find that that cost has to be taken care of by someone. And if it's not available, then we'll not be able to have a physiotherapist there, and it's not going to be sustainable for a physiotherapist to provide those services.
Mm-hmm. Makes a lot of sense. And it's yeah, it's definitely challenging, especially when, you know, the community, the knowledge level of the communities with regards to the benefit of what is being offered or what could be offered is not there. What do you find, based on all of these things and based on all that AMREF is doing with this program? How do you see this program being able to expand access to these different niches and with regards to adjacent areas of care outside of just Nairobi proper, but into some of these more rural and distant areas? And what is your hope with regards to that?
I think leveraging on the network of AMREF Health Africa, which is probably one of the biggest NGOs in Africa, you find that they're into so much public health, community health, primary health. So in a nutshell, they are not really waiting for you to be seriously ill to be treated, but some basic screenings before you can get to the level that you are not able to participate in the activities of daily living. So leveraging on their networks, when they have got other programs like nutritionist programs and so forth, it provides an opportunity. For example, if we are going to a community that has got issues to do with maternal health related conditions, we're able to tag a pediatric physiotherapist, we're able to tag a pelvic health physiotherapist, that when these mothers are being done assessment, when these children are being done assessment, we have these clinicians from physiotherapy background also able to provide assessment and also recommend various treatments that are needed. I think that is one approach that, besides training, will be able to promote accessibility into the rural communities, into the underserved communities, and indirectly that will also create awareness on the essential contributions on the wider scope of physiotherapy from what is largely been seen as purely musculoskeletal.
Mhm. And are there any other plans for any other specializations within the program, within the diploma program, to better educate the public or to better serve the public? So we've got orthopedics, we've got pelvic health. You mentioned cardiopulmonary. Any other specialties? Maybe oncology, oncological care, geriatric care, things of that nature that you feel would best help the community.
Yeah, we currently we have a short course, but if you look at the world of NCDs, non-communicable disease, I think cancer is really on top, and people are fighting it very well, but post-treatment they present with lifelong challenges that really disturb their routine life, and we get cases of lymphedema and so forth. So we have very scarce physiotherapists that have really trained on lymphedema. I think we only one that is certified internationally. So there's really an opportunity for us to also look at lymphedema, lymphatic rehabilitations as a specialization here. We are a sporting nation. We are a sport nation. We are known for athletes and so forth. And we despite having the musculoskeletal, we still feel that sport is really a specific population, and there's opportunity also to start a specialization in sports physiotherapy. It's also an area that is likely abused, whereby people wake up and call themselves different types of titles to just fit in the sport. Yeah, so with that kind of background, if we're able to have a trained one, then it's easy to govern the trained personnel as a sport physiotherapist and so forth.
I see that. Good job. Well, with regards to other physios out there who, they're already existing physios, what would you like to say to them with regards to all the offerings that AMREF has that can help to amplify where they are right now, amplify their skills, amplify them, their career, amplify what they have the capacity to offer within their own communities, not necessarily in Kenya, but beyond. What would you say to other physios out there, especially within East Africa, with regards to AMREF and why these programs are so valuable?
Well, I think number one, what I will tell my colleagues is physiotherapy is quite a unique profession whereby you're able to have what we call direct referral. And so we really need to identify where is our passion with regards to service delivery. The world is very competitive, and we also need to be competitive in ourselves. So what do we want to develop that niche, that extra skill set in it? So that's one thing that we need to ask ourselves in regards to our practice. So be it clinical, be it research, be it academia, I think any investment you do to yourself within the umbrella family of AMREF Health Africa, you can come back as a lecturer. You can form the research perspective of the AMREF. You can be a primary health care practitioner in the various NGOs, in the various activities that they conduct in the rural. So that will be what I can say, because I think for a physiotherapist to go back to school, it means a lot, especially in this kind of setting. It means investment into yourself, and you really want to see, when you invest into yourself, what will be the outcome. So those kind of investment are really just easy to discuss when you are in a position where you want to say that I don't want to probably do the same thing probably for the next 20 years. I want to do something different within physiotherapy. So if you have that kind of an urge, then you're able to look at the portfolio of the various advancements that are available. Then you're able to pick, and I'm sure you'll be able to have a reward in the future as regards to specialization, and back also to regards to your interest. Yeah, so that's what I can say. And if you look at even the setup of AMREF, it has got 11 regional offices in Africa, and that speaks a lot. If you look at Africa population of physiotherapists versus the patient needs, we're still having very, very low numbers of physiotherapists to patient ratios, be it war-torn areas, be it underserved areas, be it communal violences and gender and so forth. We still have a lot of opportunity. So it's upon us to come and get these skill sets and have the conversations of what we can do, or not what we should do, but what we are capable of doing and how we can do it, so that we're able to implement.
I agree. I think, again, just judging from my time there, and it definitely will not be the last. It was such a wonderful experience. It was very well organized. It was very, the students, again, already existing physios were very engaged with the new material, and ready to take the information and implement it within their communities. And we discussed several ways that this could be done, from just, workshops within the community, online. We discussed this within their various healthcare settings, offering education to patients or amplifying already existing patient education with regards to whatever their needs are. And then, within the hospital settings and so on. So there's such a great use for this information and for these specializations. If you are a physio and you are considering specializing in something further, these specializations are very, very helpful. Again, my background originally was in orthopedics. I worked with the athletes, I worked with the professional athletes, I worked with the professional dancers, and I worked with musicians and different things like that. And I worked with women and children, and I had a nice broad base in outpatient orthopedics, and chose to focus exclusively on pelvic health, still seeing everyone from children all the way through the elderly. But again, recognizing that that was where I felt like I wanted to contribute within my field of physical therapy. And I think AMREF is doing such a phenomenal job of being able to allow other clinicians to have that opportunity as well. So I absolutely love it. If you are a physio and you are, again, listening to this, whether now live or whether you are watching the replay, and you have considered, next steps in your career, academically, career-wise, just in terms of skill enhancement, it is definitely well worth checking out to ensure that you have this, recognize you have this amazing organization nearby that you can utilize. Are there any other things that you wish to say to the rest of your community, Henry? Anyone who is listening who may not be a part of the community within Kenya or within Africa, anything that you would like to say with regards to what you all are doing, you know, needs. My grandmother always used to say, you don't ask, you don't get. So needs or anything of that sort that you would continue to like to emphasize.
Yeah, I think um, in the community, like for example, the East Africa community, I think there's still a lot of respect for purpose
Mhm.
and and, uh, and I think right now majority of physiotherapists are really looking into how can they have master's degree in pelvic health rehabilitation and not advanced diploma in pelvic
Mhm.
health rehabilitation. I think purpose sells more a lot, and everyone, of course, will always want to have something that has got probably a very good high impact in the system. But I can just probably say that every day we make effort towards the good direction, and all these desires that people have will come to fruitful. The question is, when it comes, what will it mean when you have A, B, C, D? What I can say, when such opportunity comes that the nation or the AMREF family can offer master's degree in pelvic health rehabilitation, and you already have pelvic health advanced diploma, life will never be the same when you get into that domain of now being a master graduate. So
Mhm.
little effort will add to very big impact as long as it's consistency. So I encourage everyone that has got the opportunity, has got the desire to probably uh, have a meeting with themselves and think what is next. It's what? It's what in the long term. Sometimes may not look very promising, sometimes may not look lucrative in the beginning, but usually good decisions, sometimes they don't look very nice in the short term, but at the end time, they're really rewarding.
Mhm.
Thank you.
Yeah, I agree. I want to open up the floor now with our remaining minutes to anyone who may have a question. If you have any questions for myself or Banda, as we are wrapping this up, let us know. We're happy to, you can either ask a question, raise a hand, or we can go ahead and bring you on to talk. So just go ahead and use the raise the hand icon that you can see. We're happy to answer any questions that you may have. All right, so Chris, go ahead. You can unmute yourself.
Thank you for this opportunity. I'm called Christopher. I come from Nakuru, KMTC, and I really want to thank you for having this moment to share with us the Solomonic words that will enhance and foster our academic excellence in the world of physiotherapy. So my question just go direct to come direct to you. That I've heard my boss here, Dr. Banda Henry, saying that we should be having, should we have any opportunity to pursue a degree or a master in physiotherapy or maybe pelvic physiotherapies, we should. I mean, should it? Does it mean that it could not be a challenge to those who may not have the opportunity but have got a diploma in such profession? Thank you.
So you're asking if it would be, if you would be able to pursue um, further academic degrees like a master's if you didn't have the diploma?
I mean, if someone maybe have got the opportunity to pursue a master or a degree in physiotherapy profession, Is it not sounding competitive for this person who may be having maybe a diploma at that level? Thank you.
Henry, you want to take that one?
Thank you, Chris. I think my comment on that, if you got an opportunity to go for master degree, go for it. As I mentioned, it is very lucrative to have master's degree in our community than to have an advanced diploma. The only thing what I'm saying, in the event you still do not have that opportunity, and you're at a point where you're having a meeting with yourself on routine, practice versus career progression, then you got opportunity to choose which path do you want to advance. So in short, master degree, the truth of the matter is very superior in our clinical setting. It even give you a lot of opportunity to even participate more in lectures than even in clinical setup. So proceed for it. But if you have advanced diploma, again, there's nothing that stops you if you have opportunity to go and have a master's degree. So let me not say that I'm trying to promote advanced diploma over master's degree. What we are promoting is physiotherapy advancement as a profession.
All right, next we have Miss Wilfrida. And you can go ahead and unmute yourself, my dear.
Thank you so much, Dr. Yuan and President Henry. I think I want to thank you very much for this presentation. It has come a long way and at the right time just to encourage our fellow physios to come for this program. And on a personal level, I want to encourage all the physios who are listening in here, especially those who are coming from outside Nairobi, from different counties within Kenya, which are very far from Nairobi, if they can actually take this opportunity while we are still being taught by the experts of pelvic health, that they come to class and be taught, because the population that need pelvic health specialists is very big, very wide, from women to children to men themselves and even to geriatrics. So please come on board. And then to Henry and to Daktari, I think we also need to add the component of research into the program. I hope research is one of the modules that the AMREF students will go through so that we get acquainted to doing researches, because there's so much that needs to be done. And for me, having retired from KNH, I feel like I missed the research component because there was so much of research to be done there that can improve the quality of life and the quality of services that we offer. Thank you very much.
Thank you so much. All right, and next up we have Jasora. I hope I'm saying that correctly.
Almost there. It's Gesora.
Okay.
Thank you, though. Thanks for the opportunity. My name is Vincent Gesora, and I work for an organization called Kenya Institute of Special Education. And I want to echo or emphasize on a point that Mr. Banda has mentioned on about pediatrics. I work in a space where we have a lot of pediatric cases, and I've seen the gap that we have on the students who come for attachment there in relation to how they, how they picture themselves in a pediatric space. We have most of the cases or the issues are almost taken to by the other profession, mostly the occupational therapy, despite the fact that most of them need intervention relating to physical therapy. So my request or a talk that we should probably have is how best do we like support the profession in terms of bringing up courses in relation to pediatric, either short courses or higher diploma level courses, to support the need to have physiotherapy, get those skills, so that we don't have that confusion, or children with delayed milestones, other disabilities not getting the right management. If we can have such short courses, this will very much come in handy. And I think these are good space whereby we are, talking to people who already have this in context. They can probably advise us on the right path or the right steps to take. And I also stand in as his deputy. Thank you. On a light note.
Thank you. And next up, let's see, Eudophilus.
Yes, good evening. This is Theophilus Ondieke. I have a question to Henry, and he's a close friend of mine, so I apologize for asking too much. So I have one question to go to you. One, in 2022, the Kenya National Qualifications Authority gave KMTC higher diplomas an equivalent to a BSc, which basically could mean if someone has a BSc in Kenya, literally speaking, if we do that translation in literal manner, then you have higher diplomas in whatever the courses that are being offered currently. So if you have a BSc, then you already have a higher diploma in pediatrics, you have a higher diploma in cardiopulmonary, all those. So my question is the same applied to AMREF at the moment? Are there higher diplomas equated to a BSc in Kenya currently? And I was looking at a few instances. For example, if someone wants to go international, for example, you want to practice outside Kenya, how relevant is an HND, for example, outside there? What is it equated to in terms of the pay scale? Are our students going to get what they're supposed to get, the equivalent of it outside there? Or are we doing a course that is only going to serve the East African community? Are we training for the international market fit of it? And lastly, when are we having an MSc course from you guys in AMREF? Because I've been asking about it for quite some time. It was supposed to be there last year. It was supposed, I think, depending on assessment by the curriculum and something, but it's still waiting. Thank you.
Thank you. Henry?
Thank you, Theophilus. Theophilus is actually one of the lecturers, great lecturers we have around. So on the question of the equation of higher national diploma to bachelor's degree, I think you are aware that when that pronouncement was made, other stakeholders went to court, one of them being CUE, to challenge that declaration, and up to now that court case has not been ruled. So as we speak right now, the advanced diploma at the AMREF International University is not equated or is not equivalent to bachelor's degree. On the equivalence of the trainings that we have, whether they are competitive outside East Africa, I think Dr. Juan, you can comment on this. And we've been largely told, like, for example, the OMPT at Kenya Medical Training College is equated to residency program at the Jackson's clinics. So they are really top-notch courses. It's only that the nomenclature doesn't fit well. American nomenclature of residency, DPT, doesn't work in Kenya, which is an environment that is largely controlled by British model of training. But I think we've had, I don't know that Victoria is on this call, we've had some of our colleagues who went to work abroad, writing back requesting to be printed their certificates, for example, in lymphedema. So they are really competitive because outside East Africa, it's value for money. If you can fix my pelvis, I'll go to someone who fix pelvis. If you can fix my lymphedema, I will go to lymphedema. There's nothing like general physiotherapy. There's nothing like 10 sessions of physiotherapy, continue attending physiotherapy. It's value for money. So lastly is the master's program. Master's program, I'm not able to give you a definite date, but the plan is that as soon as AMREF International University relocate to its university, which is on Northlands, mid this year, they'll be inspected by COE to see if now they can start the master's program. They cannot start master's program currently due to the other needs like infrastructure. Where they currently are is we have got scarcity of space, among other things. So upon them settling mid this year in their own university, the COE will do another inspection. Then based on that recommendation or based on the outcome of that inspection, the university will be able to determine when is it ready to implement the various master's programs. But again, that should not stop you from doing a master program. We still have a university, our pioneer university called JQuat, offering a master's degree. Thank you.
And I want to add to that, even here within the United States, we have several different organizations that offer different types of training. With regards to the OMPT program, with residency, a residence train program is phenomenal. Not everyone that takes or participates in a residency train program goes on to sit for board certification within that specialty. So whether it's orthopedic related, whether it's sports related or what have you. Many do, not all do, because there's other costs then that are required to go ahead and apply for the exam, take the exam, and so on. For some people, depending on if their employer is paying for it or not, or they're paying for it, they may not, or they may not for some time. That being said, the biggest thing that you can do as a clinician is improve your skills from reputable sources to make sure that you have the skills that you need to serve the people within your community. If you are, whether that is, I want to dive into the world of pelvic health, whether that is, I want to improve my orthopedic skills, I want to improve my skills in pediatrics, I want to improve my skills, so on and so forth. If you work in a hospital setting, for example, you're going to see a multitude of different cases. And therefore, having a good knowledge base of maybe a little bit of everything is going to better serve you. And I've done that sometime over the years as a practicing clinician. And so it is helpful, though, to make sure that the skills that you're acquiring are coming from reputable sources. And AMREF definitely is doing that. Because at the end of the day, your patients are not going to ask you, where did you get your degree from, while you're trying to help them. They're not going to ask you, where did you get this from? Don't touch me yet. Where did you get this from? They just want to know at the end of the day that the problem that they have is a problem that you can solve. If you can solve their problem, case closed. And that's all they need to know. And that's all they really want to know. They want to know that you are the best person to administer the care that they need. And so with our efforts to amplify the AMREF program, with our efforts to amplify physiotherapy in general, that is our hope, and our goal is that physiotherapists will feel elevated enough that they can continue to be an outstanding presence within their specific and respective communities and facilities and administer that higher level of care. It starts with integrity in knowing that you're going to do what you say that you're going to do, but it also means that you have to invest in yourself and have the necessary skills to be able to do whatever that is. All right, Jacob, I see your hand there.
Hello.
Yes.
Yes, thank you so much, Dr. Joanne. My name is Jacob. I work with Center for Victim of Torture. I do deals with torture victims. So that is a very, very critical specialty in practice, which has to be really given attention because we are incorporating now mental health physiotherapists dealing with the body and mind. So that is the organization I work currently. But apart from that, allow me to just raise a concern to Bwana Henry concerning master program. I think for physio, we have emphasized so much in doing master program, but our structures here in Kenya really are not quite equipped for specialties. One will do masters, but the only field that one comes to venture into is lecture rooms. But I think the resources that is going to those is used, and those who are pursuing masters are using, is actually to improve the care of our clients or our patients. And I think part of the resolutions that need to be looked further is the facilities around, so that once we've got people advancing in master's program and going to the field of specialty, we have structures and facilities that embraces such specialty. So that if you've got a master's and you come to, let's say, Nairobi Hospital, should we see a difference after one goes for advancement for master's, PhD, should we see a difference in practice? Because it is sad, one having a diploma, one having a degree, one having a master's, but there is no distinction. Even in terms of reward, in terms of pay, no one will pay you, no one will reward you at the end of the day. So I think, Henry, you could note that so that you could bring up the discussion. We have structures, aligned structures, streamlined purposely for those specialties because they are very important. Many people are investing so much right now to specialize different physiotherapy specialties. Right now, I'm doing trauma-informed care. Trauma-informed care is part of the program that need to be embraced even in our own program because I'm working in a camp that we've got torture victims, a lot of them. In fact, we've got 1,000 people in need of those services, but we've got less personnel when it comes to, rehabilitating these people who has gone through torture, trauma. This is difficult to feel, which needs to be relooked. Resources has to be placed on, and I think that one will be very okay if that will be done. Thank you so much, Joanne and Andrew, for a good presentation.
Thank you so much. And I must say, trauma-informed care, even though it is newer in terms of health spares, trauma-informed care is a very important part of what we all need to be doing as physiotherapists. As a pelvic floor therapist, I specialize in working with chronic pelvic pain. And it's usually rarely the pain that is ever the problem. The pain is what's causing them to come to see me. But oftentimes, the pain is the result of so many other things that are going on. And typically, at the center of that for many people is some type of trauma. Whether it has been an accumulation of micro trauma or whether it has been one large traumatic insult that has occurred. But nonetheless, it's very important that that is something that we have within our toolboxes as physiotherapists, physical therapists, so that we can better serve the patients that we see. I'm going to go ahead and bring on here Dr. Dion Middlebrooks, but while she is doing so, Henry, anything to add to Jacob's comments?
Thank you. What Jacob has said is the pure truth, which I must accept. It's a big scar on us, and I think this is now not for AMREF, but this is now for physiotherapy leadership, which I sit in the country. I take it with a lot of great concern. It is not something new. It's something that we are aware of. And Jacob, thank you so much for, again, even joining this call and even reminding us of this. Dr. Joan, I think that's what I can say. It is largely on what we are talking about, career progression. Yeah, so thank you. It's well captured, and we'll continue pushing the door.
Okay. And I want to invite Dr. Dion Middlebrook. She was my co-instructor, an amazing wealth of knowledge, orthopedic certified specialist, sports physio, and just an amazing clinician and instructor. So any questions that you have to add, anything you have to add to all that has been said so far?
Yes, but before I do, I just want to apologize because I've had a lot of connection issues. So I was able to hear everything, but unfortunately not able to join as the panelist. But y'all have done a wonderful job bringing and highlighting the information that needed to be highlighted, and even having the candid discussions of things that need to take place to better implement programs. So this has been a wonderful discussion. But I just did want to add that whenever people look at the United States, especially when they see the doctoral titles in front of my name, also in front of Dr. Martin's name, they tend to get focused on that. And I'm going to tell you, we still have physical therapists in our country that are functioning under a bachelor's degree, some who are functioning under a master's degree. And the level of knowledge that they have at times far supersedes what new graduates from doctoral programs have coming out of school. So I understand the importance of advancing the field with advancing the degree, especially in your country, but don't get caught up on just a degree. The goal is to make sure that you all have the knowledge base. And I say that because she mentioned I'm a board certified orthopedic clinical specialist. I am, but that's not why I'm an orthopedic expert. I'm an orthopedic expert because of the time I've dedicated to learning the material and learning the craft. With the populations I work with, for instance, that patient I saw earlier today, being trauma informed was necessary. So even just taking the additional coursework, doing the additional research on your own, that way you'll be able to help the next generation of physical therapists as you all continue to spearhead these programs. Because yes, starting somewhere, sometimes it's starting at rock bottom and then work your way up from there. And don't let the degree itself dictate how you feel things are progressing or dictate what you think someone's knowledge base may be. Because the knowledge itself does not come from a piece of paper. The knowledge comes from the time that you are putting into gaining the resources and gaining the material. So invest in your knowledge, invest in the education. Don't get necessarily caught up on the title. It is a wonderful thing to achieve, but it is not the only thing that helps to enhance patient care and outcomes. And the goal is to make sure that you can do that for your patients. So sometimes being a generalist isn't what you need, because a person may only be able to see you and may not be able to go anywhere else, but you at least need to know enough information about all the various general topics. And other times, yes, being a specialist in something is what you need. But if you're a specialist in one thing, that is not saying you don't need to be a generalist in all things. You still need to be able to refer and at times diagnose, best treat. So just make sure that you're doing what you can to advance your own knowledge base, and don't get caught up necessarily on what titles may be there and what titles may not. The time you take to study, that's what's going to be most impactful for you and your patients.
Thank you so much for that. I couldn't have said it better. I think a lot of the times I've worked with phenomenal physical therapists, over the years that are bachelor's trained, and you can never discount years of experience. You just can't. Your years of experience, the paper is great, but you cannot discount experience. And like I said, when a patient is there and in need of care, they're not asking you where you got the piece of paper from. They're not asking you all these other questions. They're asking you, can you help me in this moment? And if you can't, can you get me where I need to be so that I can be helped? That's what matters. When we truly look at quality of care, we have to be able to meet our patients where they are. And again, when we think about degrees and so on and so forth, in urban areas, that might be something that is touted. In a rural area, again, they might not care. So when we think about these things, also just, bear in mind, what is it that you're trying to achieve? This is not to stifle your goals in any way. Still have your goals, still push to achieve, because that's personal. But when it comes to your skills, your execution, your ability to be able to help the person in front of you, you want to be able to meet them where they're at. You could be the most well-trained and highly trained person and still not solve a problem. Or you could be the person who has the training that's necessary. And I'm sure all of us have gone to a clinician, a doctor of some sort with something wrong, and they're highly regarded, and they didn't solve your issue. They were not the one to solve your issue. And when your issue was ultimately solved, it was by somebody who knew the information and knew how to apply the information that was given. So always consider that as you continue to better yourself, as you continue to take your career as physios to the next level. How am I elevating myself? How am I investing in myself? How am I executing? Because even if you go and you learn, I'm a pelvic floor physical therapist. The last 4 continuing education courses I have taken have all been manipulative courses, which I was osteopathically trained when I got my doctorate degree. But those are the things that I do, because if I don't use those skills clinically, I lose them. And I don't want to lose them, because I still have a smaller caseload of sports-related clients, of athletes, volleyball players, and so on. I still need my manual therapy skills. So I still take manual therapy classes. And for me, it's mostly to stay up to date and abreast on a lot of the research and so on and so forth. But by the same token, I still get that information, and now I can put it into practice. I can continue to practice so that I can continue to apply it. So just remember that as you consider, your own career paths and so on. We'll take one more question from Constantine. And then we'll go ahead and wrap up with some final thoughts.
Good evening. I don't know. Here it's night. It's about 9 p.m. I'm Constantine Muhale. Thank you, Henry, for organizing this. I've listened to you, Juan, and your other colleague, and I agree the most important thing, the paper is important, but the most important thing is continuous learning. Continuous learning is key. On that note, I'd like you can arrange with Henry, you give us few CMEs on pelvic health, especially like me who's in the rural setup, where even people are poor, they can't pay a lot of money. But I believe if, and I have seen already you are a good teacher, if you can give us a Zoom CME on pelvic matters, combined with some cases, we can really assist the patients here in the rural setup who are not even able to come to Nairobi or anywhere. I believe the basics and as you said, continuous learning by ourselves, we can improve with the basics you give us. Thank you.
Thank you. I'll discuss with Henry. He's my boss. So as we go ahead and we wrap up, I've heard very positive comments from all of you, and I'm very, very grateful for having all of you here. This by no means is going to be the last of these types of webinars that will be put on for you by myself and Dr. Dion. You'll see Henry again as we discuss other things throughout the year. But we really want to be able to highlight what is happening in the general world of physio, but also what's happening in Kenya, and how can we come alongside and help and be of support to all of your efforts there. Next Monday, same time, we will have a webinar on fistulas. It will be on fistulas and managing obstetric fistulas. And so I hope that all of you can join us. We'll have Wilfrida Otieno giving that webinar, and as she's affectionately known as Mom by many of you, but she will be giving that, talking to us in that webinar and discussing much of the information on fistula management, which is very important in not only Kenya, but a lot of African nations and even elsewhere throughout the world. I think it's important also because it's not something that a lot of our colleagues here get to see a lot of, and therefore it's helpful for them to also know how to manage these types of cases as well. So I'm very much looking forward to that webinar. That's going to be next Monday, February 10th, 12 noon Eastern Standard Time, 8 p.m. Nairobi time. So again, I hope that you guys can attend, and we will definitely have a replay available for you. We will have a replay available for today's session as well. And all of those who've registered will have an email sent out to them with the replay. So if there was any part of this that you might have missed, you'll be able to listen into that as well. Any final thoughts, Henry?
Mine is to really thank you, Dr. Joan and Dr. Dion, for this opportunity. I think it's one of its own. We've never witnessed this before, so we are grateful that you could even take 2 hours of your time just to give us a reflection on the potentials we have as a country and the potential we have as East Africa community. Indeed, we can only grow if we are all having informed thoughts, just like what we have been discussing here. So I think this is the beginning of many opportunities to come ahead. Thank you so much. And to my colleagues who joined this evening, I really appreciate your time. I appreciate your questions. Some questions I had, the harder they are, the more they keep us awake. Thank you and have a good night.
Yeah, Dr. Dion, anything to add?
The only thing, two things. I guess now we have a bit more work on our hands so that we can try to incorporate additional topics, which I'm extremely excited for. So Henry, you haven't gotten rid of us yet. And I'm also just want to make sure everyone knows that even though next we're going to be talking about fistulas, if you are orthopedic, if you're neuro trauma informed, whatever type of therapist you're functioning as, please make sure you still join, because you may be seeing these patients and not even know it. And you at least want to make sure that you're asking the appropriate questions. So that way, if you're not able to treat them, you can at least refer them to someone who's able to, or at least maybe you can be that guiding source. So even if a topic's not related to your specialty, still make sure you tune in, because those are different things that you can learn to better care for your patients. And that is the goal, is to enhance our patient outcomes. That is the goal.
Absolutely. So from all of us to all of you, thank you so much. And everyone have a wonderful, wonderful evening. Take care.